doing a video on chest physical therapy. My name is Claudia Silva,
My name is Brent Charles.
And I'm Corey Collins.
the woman behind the video camera. We are students from San Joaquin Valley College, the RT program, and this is a video step-by-step of doing chest physical therapy.
And action.
So the first step you would do would be to verify the orders.
Verifying, verifying, verified.
The next thing that the RT would do would be to wash his hands and glove up.
And remember, always wash your hands for 1 minute, no less, and make sure that you're pointing up so that way you're not recontaminating your hands.
And please don't mind the babies.
They're not real.
After gloving up, the RT would select the right equipment for the procedure.
But because we're using our hands for this procedure, we do not need to set up any kind of equipment except for our own hands.
After gloving up, the RT would go into the patient's room and properly identify the patient by checking the ID name badge and identifying himself along with the department.
Come in.
Good morning, Miss Silva. My name is Brent. I'm from Respiratory. I'm here to give you CPT.
Good morning, Brad.
All right. And may I check your name badge real quick?
Sure.
And can you tell me your date of birth, please?
May 22nd, 1988.
Thank you very much.
You're welcome.
Okay, now, the reason why I'm giving you CPT is to help you get rid of some of the fluids and secretions that have built up in your lungs.
Okay.
Okay?
All right.
And would you be willing to sit up for me so I may take your vitals?
Sure.
Okay, now I'm going to set you in the position. So if you would just lay back, I'm going to remove your pillows. If you want to lay back for me. And then if you can, just lift your legs up for me. Okay. Now this position is used for the anterior section of your lungs. What it does is going to help you drain those portions and help you cough up the secretions. Now if you're able to, the usual time is between 3 and 15 minutes if the patient is able to stand it. So I will come back in a few minutes and check on you and see how you're doing. I'm going to go chart your information. Yes.
Is this the only position for CPT?
No, there are actually many other positions, but the doctor has ordered this position to help you remove the secretions from your anterior lungs.
Awesome. Thank you. You're very knowledgeable.
Thank you very much. We'll see you in a few minutes.
Okay.
And how are you doing, Miss Silva?
Much better.
Much better? Okay. So no pain, is your breathing okay?
It's great.
It's great. Okay, I'm going to remove the pillows.
I feel like I'm at the spa.
All right. All right, I'm going to lift your head up again.
Oh, thank you.
You're very welcome.
So kind.
Now, the next step of our demonstration is to perform percussions. That's correct. Always getting tongue-tied. That's never good.
Trust me, I've done this plenty of times. I'm always sick.
All right, Miss Silva, if it would be possible, could you sit up for me again?
Why, of course.
Okay. So now what we're going to do...
Do you want me to sit down or stay in this position?
Well, if you like, we can move your legs to the side.
Okay.
Okay. And so, because we're working on the anterior portions of the lungs, we're going to be percussing in between here. Minding you to stay away from bony protrusions, organs, and just any other things that would cause harm to the patient. So how you do percussion is you're going to cup your hands like this, like you're
Like you're making a little teepee.
pretty much like that. So you're just going to go.
Oh, yes.
And the normal range for this would be 3 to 15 minutes. And we're just moving up in a up and down motion to make sure that if there's anything in the lower lungs, we grab that as well. 15 minutes later,
you that every position that you're in, the least minimal time is 2 to 3 minutes per segment, hence the 15 minutes if you do 5 segments.
And how are you feeling, Lucilla?
Oh, great.
Much better?
Like the spa days.
Okay, well, I'm going to check your lungs just one more time and check your vitals. So if you would mind, please sit up straight and just, take a deep breath for me.
Oh, okay.
And while you're sitting up straight, would you be able to cough for me?
Of course.
And did that feel like it brought up anything?
I felt like I had just had lunch.
Just had lunch. And that was one of the outcomes that we're looking for in chest physical therapy, is the removal of secretions. So now I'm going to check her lungs and do vitals on her. And remember, after every use, clean your stethoscope with a alcohol wipe or tabby wipe to prevent spread of infection or other bacteria.
Nasty.
And my stethoscope is clean, so we're going to continue with listening to the lungs. Take a breath for me. Another one. Another one. One more. One more. One more. Take a breath. Breath. And if you lift your arm up for me, take a breath. One more breath. All right. And then we're just going to take, remembering that this finger gave us the most trouble the last time, let's start with the middle finger this time. If you'd like to lay it down, I'm going to check your pulse.
Okay.
And during this time, I'm not only checking her pulse, I'm getting her respirations.
Incognito.
Because if a patient knows that you're checking his or her respirations, they might alter the way they breathe so they may seem normal. So you do it incognito, you get a more accurate reading. Okay.
Thank you.
I thank you very much for allowing me to help you out in your chest physical therapy. Is there anything else I can get for you?
No, thank you. You've been
Okay,
very kind and helpful.
Would you like to lay back?
Of course.
Okay. There you go. And if you took down the rails, you put up your rails and lower the bed to the lowest possible position to make sure that if the patient does fall out, he or she doesn't have that far to fall, and minimal damage can be prevented.
Remember, return the room the way you found it, just in case.
All right, Miss Sybil, we'll see you later. And if you need anything, you just give us a call.
Oh, I will.
You have a great day.
Thank you.
After the RT leaves, he will go and chart what position he used, also the percussions, the breath sounds after and before therapy, the cough, and sputum production.